Namaste, I am Dr. Amit Choraria and I am an oncosurgeon as well as robotic surgeon. I work at Apollo Multispecialty Hospital in Kolkata. Today I will talk about female reproductive organ cancer and the scope of robotic surgery in these cancer. Common female cancer is the cancer of cervix, followed by ovarian cancer and then uterine cancer. Now, the lowermost part of uterus is called cervix and the cancer of this cervix is called cervical cancer. Most of these cancers are caused by HPV infection, which can totally be avoided by HPV vaccine, which is widely available. Second thing is uterine cancer. The cancer of the body of uterus is called uterine cancer, or in other terms it is called endometrial cancer. Cancer in female reproductive organs can be diagnosed with regular pelvic examination and screening for certain gynecological cancers. For example, Pap test and HPV testing is very effective in detecting cervical cancer. Such examination can sometimes prevent cancer by detecting precancerous changes like dysplasia before they become cancer. However, cancers of ovary, uterus, fallopian tubes are not that easy for doctors to detect during a pelvic examination. If a cancer is suspected, a biopsy can confirm or rule out the diagnosis. A sample of tissue from the affected organ is removed, examined under a microscope and analyzed. For some cancers such as ovarian cancer, surgery must usually be done to make the diagnosis and not biopsy. If the cancer is diagnosed, some investigation may be done to determine the stage of cancer to know how large the cancer is, how far it has spread. Some commonly used investigations include ultrasonography, CT scan, MRI, and PET scan. For all cancers, the stages range from the earliest stage 1 to most advanced stage 4. Gynecological cancers can spread in following ways. Number 1, directly they invade the nearby tissues, which is called transperitoneal spread. Secondly, they metastasize or spread through lymphatic vessels and lymph nodes, which is called as lymphatic spread. Thirdly, they metastasize or spread through bloodstream to distant parts of body, which is called hematogenic spread. Depending on type and stage, the treatment may include surgical removal, radiation therapy, or chemotherapy. Let's talk about chemotherapy. It is usually the most effective way to treat any cancer cells that have spread beyond the original site. Chemotherapy may be given by injection, by mouth, or through catheter inserted into abdomen like intraperitoneal chemotherapy. Next is radiation therapy. It is usually given if the tumor has spread to the surrounding tissues that are next to the original tumor, such as spread of tumor of uterus to the urinary bladder. For some gynecological cancers, hormonal therapy or hormonal blockers are given as additional treatment, usually after surgery, chemo, or radiation. So, hormonal therapy works by stimulating or blocking hormonal receptors to stop the growth of any tumor cells that have spread from the original site. Now, let's talk about surgery. So, the older times there used to be open surgery and there used to be a cut in the abdomen. So nowadays there is robotic surgery where there is no cut in abdomen and we do the surgery with so few tiny holes. So let's talk more about it. So robotic surgery might sound like a plot right out of the science fiction novel, but the truth is the technology has been around since 1980s. Robotic surgery is when a surgeon uses a robotic device to do the operation. Robotic surgery is a state-of-art treatment that combines technology and precision. There may be common perception that this procedure is performed by a surgical robot, but in reality, a specially trained skilled surgeon controls the robot. The robotic tools are attached to a console which allows the surgeon to see a clear, large 3D image of the patient's surgical site. The robot acts as assistant to the surgeon and helps to perform the operation accurately. The device has robotic arm that can hold small surgical instruments. Surgeon moves the robotic arm using the controllers and a viewing screen. These surgeons are additionally trained to do robotic assisted procedures through a formal training called fellowships. You can inquire about the same from your treating surgeon. Robotic surgery can be done in non-cancerous conditions also, like for example fibroids, endometriosis, abnormal bleeding from uterus. So in application in gynecological cancers is also now increasing because of the established benefits in uterine cancer like endometrial cancer. Newer studies have also established its feasibility and safety in early cervical cancer and early ovarian cancer in selected cases. Compared to traditional open surgery, robot-assisted surgery offers benefits like lesser pain during recovery, lower risk of infection, reduced blood loss, shorter hospital stays, quick recovery, quick return to workplace, and smaller scars. Robot-assisted surgery currently has an overall success rate of 94 to 100%. Individual success rates depend on what type of procedure you need, your general health, and some other factors. For more information and opinion, you may contact us at the below mentioned numbers. Thank you for listening. Namaskar.